It is so wonderful to have you three brilliant people with us today here at Global Citizen Now, the first time in Australia. Let me introduce you to our panel. Once again, the Chair of the Board of the Global Fund to Fight AIDS, Tuberculosis and Malaria, Lady Roslyn Morauta. Welcome. Round of applause, I think. Director and Chief Executive Officer of the Burnett Institute, Professor Brendan Crabb. And Chief Resource Mobilisation and Growth Officer, the GAVI, the Vaccine Alliance, Marie-Ange Saraka-Yao. Let's get into it. I want to start with you, Marie-Ange. This past year, we've seen that GAVI crossed the incredible milestone of, this blew my tiny mind, 1 billion children have been vaccinated against deadly diseases through its programs since 2000. I think that deserves a round of applause. Obviously, we imagine that this came at still a very challenging point, obviously with the pandemic, COVID, things like that, and many countries still being disrupted by it. Tell us, where are things at now when it comes to rolling out vaccines all around the world?
So thank you. I think indeed it's really marvelous to have reached that milestone of 1 billion children immunized around the world. And actually, I should say 500 million in the Indo-Pacific region, so the region really around us here. But of course, I think the first thing really what we realize is how important this milestone is, because it makes us realize that we can make things happen, especially with a lot of the people here supporting us. Despite the pandemics, despite many of the challenges that we faced. Now, of course, what we see after the pandemic is really that things are going up, that we are moving back to pre-pandemic levels. But of course, averages, mask a lot of differences. And what we learn really clearly is how important having strong health systems, how important it is. We wouldn't have been able to vaccinate during the pandemic 3 times more than we typically do hadn't we built strong health systems. But what we also realize is that they are not everywhere, and we need to double down on making them stronger everywhere. We need, of course, to reach everyone. And there's what we call the zero-dose children, the children that have never received a vaccine. So in this region, as I said, we have done a lot, but you still have 2.5 million children that have never had a vaccine. So it's kind of the weak link in terms of outbreaks, in terms of transmission of diseases. And it's also about, fighting some of the misinformation, making it faster and simpler to reach people. So all these are very important. Of course, on top of this, we see new challenges arriving. I know in the panelists before talked about the challenges of climate change, that, now we see new vectors, more vectors, around the world, and you have some climate-sensitive disease, malaria, yellow fever, cholera, we see a lot of outbreaks. So we really need to continue working on this. But we can all make it happen, and that's what this 1 billion is about, that we can collectively, and a big shout out of all the people here that have helped us make it happen.
Yes, congratulations to you all. It's just absolutely incredible. And like you say, Senator Birmingham did talk about the misinformation that needs to be combated, so it's a very, very good point. Lady Roslyn, you are an icon when it comes to the medical world. The Global Fund has had a unique role, not just in terms of fighting HIV and AIDS, tuberculosis and malaria, but more broadly as the largest provider of grants for health in developing countries. It is a critical systemic impact. So what are the key opportunities and challenges that you can see at this stage, I guess in 2024, post-pandemic, towards strengthening healthcare systems in vulnerable countries to the point where they can be more capable to help defeat diseases?
Thank you, Jenna. And just not to correct you, but to say I'm not an icon in the medical world at all. Maybe we could call Brendan
You all are.
But definitely in terms of advocacy for health throughout the world. The Global Fund is the biggest funder of grants to middle and low-income countries for health system strengthening. So we're called the Global Fund to fight HIV, TB and malaria, But as Marie-Ange pointed out, you can't vaccinate without a good health system, and you can't deliver HIV, TB, or malaria programs without a good health system. So we have invested a lot historically in the pillars of a good health system, whether it's laboratories, surveillance systems, data systems, supply chains, and health workforce, very importantly, community as well as the formal health workforce. And a good health system is a prerequisite to fight the current pandemics that we face. We still need to call all of the diseases we fight pandemics, as well as to prepare for future ones. And COVID really taught us that. The countries that responded best to COVID were ones that had stronger health systems. It was so obvious that was the case. So in the next 3 years, the Global Fund will be investing $2 billion every year in health system strengthening.
Amazing. Like, that deserves a round of applause. Again, I rest my case, an icon of the advocacy world, and now to an icon of the research world. Professor Brendan Crabb, it's such an honour to chat to you. I guess one of the pandemics that we have spoken about is malaria. It is really rearing its ugly head around the place now. Where are we at in terms of research and fighting to eradicate this disease?
Well, we have a new vaccine, and so to set the scene though for this amazing new powerful tool, and just because I've just heard from Marie-Ange and Lady Ros, you know, it's worth just talking about the power of science in general, and why I think this malaria vaccine is going to be crucial. You know, we have a global fund for HIV, TB, and malaria, and notwithstanding what Lady Ros has just said about health systems and other things being so important, but it's deliberate. We don't have a global fund for typhoid or cholera. We don't have a global fund for smallpox or polio or diphtheria or measles or mumps or rubella or tetanus, all of which we would have had a global fund for if science hadn't intervened, right? And so the success, particularly vaccine-based success, but also public health success, clean water, hygiene, sanitation, and most importantly, the availability of those interventions and tools and knowledge to everybody, not just those who could afford them, has seen the elimination, or at least the great reduction of all of those things. And hence, life expectancy's gone from human history around 35 or 40 to around 65 to 85 all over the world now, because of those things. But we have a global fund for HIV, TB, and malaria because some diseases are harder. They're harder, technically harder, and they're harder because they're more ingrained as diseases of poverty, of issues of neglect and marginalised peoples. So what you look for is new great tools, and then to make those tools available. And so I'm a parasitologist, I'm a malariologist, and so I never thought in my lifetime we'd see a vaccine for malaria. We now have two, and there's a 40-year history for that, so science can take a long time. And the most important issues are we now have to get that vaccine to everyone, not just those. It's not actually cheap. We have to get it to everyone. Secondly, you can't drop one of the interventions that's working well. Insecticide-treated bed nets, treatment programs, test and treat programs. You can't drop those. You've got to add this to to what's there already, especially through health system strengthening that Lady Ros has spoken about. And you've got to build on the success. It's not the best vaccine going. Everyone in this audience has become a vaccinologist through the COVID pandemic. You think, why isn't it a magic bullet? Vaccines are a tool that are incredibly powerful, but they're not everything. So we have to use the other things we have, and we have to build on and say, great, but we can do better.
Well, I guess that sort of leads us into another question, Marie-Ange. You know, I really hate the term cancelling something, but we cancelled smallpox in the 70s, and now we're sort of on track to look at polio. I guess what is being done around research and development in also tackling that now?
Well, I think it's a perfect segue to what Brandon was saying. I think really to eradicate a disease, you know, there are really several things that are key. Of course, science continuing, and their vaccine have played a critical role, but continuing on that search is very, very important. I mean, Brandon talked about the malaria vaccine that we are starting rolling out. but also we have extraordinary vaccines that are coming up in the next 2 or 3 years. You know, we have dengue, we have a new tuberculosis vaccine that is very promising and that will be very important for that region. So vaccines. But then with that, we need commitment. You know, eradicating a disease is not a sprint, it's a marathon. So again, we need everybody in that room, but we need the complementarity we have been talking about here, you know, the complementarity with other intervention, the complementarity with science, the complementarity with demand-side interventions. And by that, I mean making it easy for people to get the vaccine. Because a lot of emphasis is sometimes on the supply side, but how you get it, taking into account, you know, the circumstances, the geographic circumstances of the countries. So we are now working, for example, on vaccine that can stay outside the cold chain at 40 degrees for several days. It's important because not everybody has next to it, you know, the right infrastructure or these type of things. We are working on innovation, and for this we work with some of the Australian companies delivering drones in other parts of, delivering by drone some of this servicing, but it really helps, you know. And so that's very important. And here what I want to do is a big shout out at Australia, of course, because when we think about eradicating disease, you know, Australia has been the champion for the HPV vaccine and, you know, for cancer elimination. And it's probably, you know, the first country that will reach that milestone much earlier than we thought by 2028. So it's a big, it's important to have something to look up to, and especially for countries to know it's possible. And so in that sense, it's fantastic because we are bringing together the science of, you know, Ian Fraser, of course, making the vaccine available with the financing, because we do need financing. It takes a lot of money to make it happen. But at the same time, you know, organizations like GAVI, the Global Fund and others, to pool these resources and make it affordable. You know, this is a vaccine, for example, that is $100 a dose in the US, but we make it available at less than $3 because we are pulling basically 4 billion, we are pulling the demand. So having all these mechanisms are really key. And I think that's some of the things that, of course, Australia has been shining in terms of bringing their leadership to that aspect.
Yeah, you're so right. HPV, it is, Australia does seem like a world leader with, you know, bipartisan support, pushing it forward, and science and also funding, which is fantastic. I want to go to you, Lady Roslyn. In your recent experience where you visited many countries contending with diseases like we've spoken about, malaria and HIV/AIDS, what common threads are you seeing at that community level, and where there are, as Marie-Ange says, you know, gaps in access and even education?
Thank you, Jenna. And just to elaborate first on what Brendan said about why we have a global fund to fight HIV, TB, malaria, and because they're difficult, but they also are the biggest killers in the world, which is why we have a global fund for HIV, TB, and malaria. But since we were founded in 2002, extraordinary progress. 59 million lives saved through the Global Fund partnership. There's been a reduction in deaths from those 3 diseases of 55% over that period. Yes, COVID set us back, but we are recovering. But there are new threats, and this is what we're seeing now. New infections, particularly amongst vulnerable populations, inequitable access to health because of political issues, conflict, erosion of human rights in many countries is affecting people's access to health. New infections, resistance to drugs, resistance to insecticides. These are the problems that we have to take into account now. And absolutely central to tackling these is to work with communities, not just formal health systems. And Global Fund puts communities at the center of everything we do. It's really important we strengthen community health workforce. We strengthen the community networks. This will be the way that we overcome some of the barriers to equitable access.
this leads us to you, Professor Crabb. Now, I think a lot of us listened to many health professionals during the COVID pandemic. You were a vocal champion of all things vaccination and things, where you and I guess we all saw extreme inequity between rich and developing nations in terms of access to those vaccines. How do researchers and developers fit into, I guess, this broader puzzle? And what changes are needed from countries like us here in Australia to ensure better global access to the medical innovations developed to defeat disease, whether an existing threat like malaria, or as you say, there's, you know, these morphing bugs that we're seeing pop up around the world?
Well, there's always a shopping list of things that are important to do, and this whole meeting is talking about avenues to address poverty and this particular panel around health issues. And of course, here we're all preaching to the converted in issues of equity, but the most important point is that whatever we do, including in the science world, has to be seen through the prism of equity. You know, the pandemic, the COVID pandemic, according to WHO, is still going. According to me, it's still going. And it's caused so much trouble, you know, 25 million deaths or so, 100 million plus cases of long COVID, and still in the 3 or 4 or 5 million people dying a year of COVID. The reason it was so bad and ongoing is because of inequity, both within our own countries, even in rich countries, in middle-income countries, and most definitely in low-income countries, the premise of your question. Inequity is the reason, the core reason it's still going. You know, it's not just been a moral and ethical failing, which it is, to have hoarded vaccines in rich countries and needed the amazing work of the Global Fund, GAVI and other partners to get some vaccines to people, and it was a really brilliant effort. It's not just immoral and unethical, it's actually an own goal, right? The reason it's such a problem, Australia had 10,000 deaths from COVID this year. That wouldn't have happened had there not been new variants. Every new variant has come from an under-vaccinated or unvaccinated country. For example, infectious diseases are numbers games. You need to get the numbers down. You can't just say, as a rich country, we're going to protect ourselves. It doesn't work, right? So equity is absolutely crucial. And just picking up finally on something Marie-Ange said about demand. We're very good on the science of supply, you know, on making stuff. We're not so great on the science of demand. Do people want it? Can they get it? In what form would they want it? Community X might be different to Community Y. Have we asked them, to your point, Marie-Ange? And the answer is usually not, or not in a scientific, social science way. So we need to put equity at the centre in our own, you know, in an Australian context, rich country, good at science and good at development, needs to say, this is not just something nice that we do for our neighbours, as crucial as that is. This is for ourselves, this is for the world to advance, this is for us to advance. And to see it as an investment in our own community, not just an investment in those around us, even though for me that would be enough. But it's actually more holistic than that, and I don't know that we see it quite that way.
It's interesting. I feel there's a common thread between all the conversations that are being had today. Like Chris Anderson spoke about building a bridge, and you can do it at a micro level or what you're all doing at a macro level. It's absolutely incredible. Marie-Ange, this sort of leads me to my next question. You know, malaria, polio, HPV. What's GAVI doing to step up the fight against disease?
Well, I think the first thing really that we are doing right now is really accelerating the access of these vaccines to the various parts of the world, and I'm really glad to be able to announce today that we will be supporting, you know, Timor-Leste in the introduction of the HPV vaccine, you know, by June 2024. I think that's really incredible, and I know we saw the Prime Minister earlier, and we are very excited because actually in that country, you know, more than 420,000 women are at risk of cervical cancer. Is the second most common cause of cancer for women. And so making that vaccine that is so powerful is one of the most effective vaccines that we have. It covers 90% of the cervical cancers. So it's really, really powerful. So making it available and really stepping up the fight, especially I think by the end of the week, we're celebrating International Women's Day. So it's really fantastic. And of course, we have made a pledge in GAVI, to support by 2025 more than 86 million girls with the HPV vaccine, and we are well on the way, especially in that region. This year, we already had 7 HPV introduction in Indonesia, Myanmar, Bangladesh, some of the islands also, and Sin Timor-Leste, and then after that, Philippines, Vietnam. So really, really exciting, and of course, being able to do it with all of you here. So I think that's extraordinary, especially how important it is, and hoping we can do that for some of the other vaccines that are coming up.
Look, I'll take that over cupcakes any day when it comes to International Women's Day. That is a fantastic announcement. And I guess the Prime Minister of Timor-Leste would be thrilled with that news, as we know he is. And this will be a big year for GAVI, with the organisation set to embark on its next multi-billion-dollar fundraising campaign to fund global vaccination over the next 5 years, as you mentioned. What would a fully funded GAVI mean in the fight to defeat diseases going forward? And how can we get the international support needed to get you there?
No, I think it's important because first is the last opportunity. GAVI has a 5-year cycle. So it's the last opportunity before 2030, right? The SDG goal, to be able to accelerate and step up and bring science, vaccines to the people who need it the most. And so obviously it will mean really accelerating, catching up on some of the gains that we lost during the pandemic. And obviously, it will be about HPV, polio, but also about rolling out new vaccines that are now becoming more powerful: malaria, dengue, later tuberculosis, of course, in complementarity with the other interventions. But also reaching out, as I said, about the zero-dose children, because unless you reach these children, the people who didn't have access to any vaccine, that's actually how a pandemic starts, because that's the weak link. And very important, and be ready to protect people's health, especially in the fast changing climate change. We talk a lot about climate change, about decarbonization, net zero transition, but we talk less about how we protect people's health. And the beauty is that we do have a portfolio of vaccines against climate-sensitive disease. So there are already tools, but we need to make them available faster to people, because with the climate change, vector-borne disease are spreading. Disease that you didn't see in some part of the world, now you see it everywhere. Now you have malaria in France, in the US, and so on. And spreading also faster in the region, or dengue. So we need also to scale up. So we will need all of your support for this, of course, and commitment.
Well,
Thank
it's
you.
amazing. And having, I guess, just to recap, that is incredible. So from July 2024,
Yes.
women and girls in Timor-Leste will have access to the HPV vaccine. I think that deserves another round of applause. Well, we've pretty much defeated diseases here today, so I think it's time to wrap things up. Lady Susan, Professor Brendan Crabb, and Marie-Ange, thank you so very much for joining us. And thank you, Global Citizens Now, for that incredible exclusive announcement.